Hello and welcome to Newsclick. The 45th session of the Indian Labour Conference was recently held in Delhi. It had discussed on the issues concerning the scheme workers and had suggested certain recommendations. To discuss on these, today we have with us Dr. K. Hemalata, National Secretary of the Centre of Indian Trade Unions. Welcome, ma'am. Could you please tell us what the discussions have been on the issues of the scheme workers and what are the recommendations?
The 45th session of Indian Labour Conference for the first time discussed the conditions of work of the scheme workers. There is around 1 crore such scheme workers, and the national this ILC they have discussed, and it was recommended that the scheme workers should be recognized as workers. They should be provided minimum wages, social security benefits including pension, and they should have the right to organize and collective bargaining. These are the main recommendations of the ILC, and all the trade unions unanimously argued for this. The state governments also agreed for that, and only the Women and Child Development Ministry and the representative of the Education Ministry, they had some reservations on providing minimum wages, on recognizing them as workers and providing them pension. But all were unanimous that their conditions need to be improved.
Who are these scheme workers and what is the work that they do?
Actually, there are two aspects. The government, since during the last around 2 decades or so, have been starting many schemes. You may start schemes to address certain problems of the people, but the trend is that to provide the basic needs of the people in education, whether it is health or food, nutrition, etc., which are very much necessary for the development, human development of our country. In these areas, the government is starting schemes. So, on one way, the government is not providing these services to the people as entitlements, as rights to the people. Instead of providing them as rights, they are starting schemes which can be closed at any time. So, as temporary measures, and on the other hand, they are also not providing adequate financial resources for these schemes. So, you see the Integrated Child Development Services scheme. It is a scheme which provides for the development of the children, the supplementary nutrition, health care, preschool education, etc., for the holistic development of the children of our country. It is not a temporary measure. It is a permanent. As long as the children are there in our country, they require these services, but instead of providing them as entitlements, the government has started this scheme in 1975, and till now, it is more than 37 years, it is continuing as a scheme. And today, around 27 lakhs workers are working in these schemes, in this ICDS scheme, and many of them are working since the last more than 30 years. So, on the one hand, the people are being cheated that we are doing so many things, it is a flagship program and we are spending all these things. On the other hand, the workers who are working in these schemes, they are not even recognized as workers. Those all of them are women. In ICDS, the Anganwadi workers and helpers, all of them are women. So, these women and workers, they are not recognized as workers. They are called social workers and they are provided a honorarium, which is very meager. The workers are provided 3,000 per month by the central government, the helpers are provided 1,500 per month, and which is only a fraction of the minimum wages. They are working as skilled workers, they are provided training and they are working as skilled workers. And now the other scheme, National Rural Health Mission, that was started in 2005. That also addresses the main concerns of health for the particularly women in the rural areas, and around 8.5 lakhs women are working as ASHAs. ASHAs is accredited social health activists. So, they are not even called social workers, they are called activists. The government gives a long list of jobs which they have to do, and they say that they need not be paid anything, because while doing their regular activities they can do these things also, which is not possible, because they have to take the pregnant women, they have to conduct a survey, identify the pregnant women, ensure that they receive health checkups, immunization, etc., and also encourage them for institutional delivery. When the pain starts, they have to take them, accompany them to the hospital, all these things. So, even if it is midnight, they have to take the women to the hospital, and despite that they are only called activists, and they are not paid even an honorarium like the Anganwadi workers. No. Anganwadi workers, they are paid at least some honorarium, a fixed amount, but the ASHAs, they are not paid even an honorarium, and they are paid an incentive, that is a piece rate. If you perform this, if so many women are immunized, then you get something. If so many persons are opting for family planning methods, then you get something. If so many women are taken for institutional delivery per women, they get something. So, there is no fixed amount that they receive. And then the midday meal workers, that is also another flagship program of the central government, and that was started in 1996 and modified several times. Now, it is widened, spread, and around 26 lakhs workers are working as cooks and helpers under this midday meal program. Till 2009, they were not paid anything, only per child allocation was there, and 40 paisa per child they were getting, and since 2009 the government has fixed 1000 rupees per cook and helper. But even that is not paid throughout the year, only for 10 months, and during the holidays there is not paid, and in some states it is not implemented properly. It is divided into the 2 persons, 500, 500, 600, 400 like that, and that is the midday meal workers, and they do not get any other benefits. No other benefit, neither pension nor health benefit nor paid leaves, nothing. And now, another interesting thing is, because of the work of these ASHAs, the number of institutional deliveries has increased. The government itself has acknowledged that. Recently, there was also an advertisement that they are the backbones, everybody praises them, but to meet this situation, what needs to be done is increase the number of nurses, etc., health personnel in the hospitals. Instead of doing that, the government has entered into an agreement with the Netherlands government, and they have started another initiative which is called Yashoda. So, now they
Very
are appointing
fancy names they give.
Yashoda and Mamata. So, they are trained for a few days and appointed in the hospitals round the clock in shifts, all the 24 hours. They do all the jobs that a regular nurse does except giving medicines, but they are paid only a consolidated amount of 3000 rupees per month. And after 3 years, 20% of the Yashodas will be replaced. So, after working for 3 years, that particular Yashoda will be removed and another Yashoda will come. So, these are the different types of things, and similarly under the Sarva Shiksha Abhiyan, another flagship program of the Government of India, regular teachers are not being employed, para teachers, they do the same thing, same teaching, but they are only paid a consolidated amount. So, we had made a rough estimate of all the different, there are several other schemes also of the central government, like in agriculture, there is an Atma scheme. What is that? Some agriculture technical management agency scheme, and around 3 lakhs workers are doing that. The same job earlier, before 1990s, the extension workers were there in agriculture in the villages. Now, they are removed, and they are named Krishak Sathis, Raitu Mitras, in different states, different names. So, like that, in different schemes, around 1 crore workers are working today. So, the major thing is, these workers are denied, just to deny them the minimum wages and other associated benefits. The government is calling them in fancy names, denying them the status of the workers.
The Prime Minister says that these workers are the pillars of social and human development in our country, yet he says to pay them minimum wages and to recognize them as workers, he has financial constraints, and especially due to the economic downturn and all that we are witnessing. How far is this true?
The CITU has made some effort to organize all these sections, to unite all these sections, and on 26-27 November last year, we organized a very big Mahapadav and then made a representation to the Prime Minister when he made these remarks that they are contributing to the human development of our country, and they are the pillars, the Anganwadi workers, the ASHAs, midday meal workers, etc. But the point is, he says that we do not have the money. He will discuss with the finance minister, and he says that all your demands are justified, your demand for minimum wage is justified, your demand for pension is justified. And earlier, when the Anganwadi workers and helpers met him, he said that we will pay them some parting gift, because after 30 years they are being retired, they are not recognized as workers, but they are being retired. Now they say it is called disengagement, because if you retire then you have to pay something, it is disengagement. And he said that we will give you some parting gift, not pension or gratuity, some parting gift. Okay, we said you give that, but till now, since 2006, 2013 nothing is given, and the main reason is financial constraint. So, every year in the budget the government is providing different types of concessions and incentives to the big corporates, which amount to approximately 5 lakhs crores each year. So, even if these workers are recognized, all the 1 crore workers are recognized and paid 10,000 rupees per month, as the trade unions are today demanding that minimum wages, any worker should be paid 10,000 rupees per month. Even if they are paid in that amount, it will be around 1 lakh crores or so per year. So, every year 5 lakh crores the government is providing incentives to the big corporate houses, but they are not ready to provide even a small part of that amount to these workers who are contributing to the development of our country. In many studies have found that where the Anganwadi centers are there, the immunization level has increased, the malnutrition has to some extent decreased, school enrollment has increased, school dropout has decreased, all these things are there. Similarly, the midday meal program, now the ASHA, all these, they are proven indicators are there, but instead of even increasing the allocation for these schemes, what the government is doing is that the allocation is not increased, not
budgetary
allocation for these schemes are not adequate, and then the workers also not provided minimum wages and other benefits.
Most of these scheme workers are women, overwhelming majority are women. How is their status in the society changed with the involvement in such schemes, with the work that they do?
Actually, wherever they are working, they do get recognition, though their payment is very low. We find in many places the Anganwadi workers and helpers, because they have access to the women particularly, and they go to their houses and they advise them on many aspects, there is a very good relationship with this, and there is a recognition of their services. Similarly, about the ASHAs also, on many other questions also they come and talk to them, and I feel that because of that they are doing, actually they do get, there are problems definitely because they are women, they are low paid, and particularly another thing is that many of them come from socially backward sections, many of them, because the criterion for selection of the Anganwadi workers and helpers and the ASHAs is that they have to be selected from the community. So, they do come from the socially backward sections. They face many other problems, but still in many places they are actually they are the ones who are subsidizing the government and implementing this program.
Exactly, which is the irony. Instead of the government paying them, they are
subsidizing the government and doing, and they do get some satisfaction. We ask the midday meal workers, how are you providing? Because they do not get even paid for that. They have to spend from their pockets, or they get loan from the shops there to buy the vegetables and other things which are required. Government provides only the rice etc. from fair price shops, but other things they have to buy. But and for 5 months, 6 months they are not reimbursed, but still, because they feel that we are feeding our own children in our own village. So, how can we not feed them? So, similarly the ASHAs, even midnight when they get a call from some pregnant woman that she is in labor and she has to accompany, she leaves her own children and accompanies her to the hospital, the pregnant women, where they do not even have any place to rest, and they are ill treated by the staff or the regular staff of the hospital, but still they are doing that. So, it is the sort of commitment that they feel some satisfaction in doing their job.
Do they have the security of work? I mean, is there hire and fire, and how is it?
Basically, to deny them the job security, the government is resorting to this practice. So, even after working for 30 years, the Anganwadi workers and helpers, they do not have any job security. No other segment of these workers have job security, and now the government is trying to privatize all this, that is ICDS, in the name of strengthening ICDS mission. The Prime Minister has announced around 2 years back that because still malnutrition is a very big problem in our country, we have to look beyond ICDS. So, instead of providing adequate resources to ICDS, now in the name of looking beyond ICDS and also strengthening ICDS, what the government is trying to do is to privatize it. Now, it has taken a policy decision that at least 10% of the Anganwadi projects, ICDS projects have to be handed over, must be handed over to NGOs. And then the preschool education component, they are encouraging nursery schools, private nursery schools. So, when there is an Anganwadi center here, just in the vicinity somebody is encouraged to establish a private preschool, nursery center or primary, pre-primary center school like that, and they are provided incentives. So, the children are withdrawn from the Anganwadi center and sent there, and different departments like the rural development department etc., they are establishing nutrition center in the vicinity of the Anganwadi center. So, the work of the Anganwadi centers are being weakened, and ICDS is weakened, and the Anganwadi workers, they are told that if certain number of children are not there, then you will be removed from service. Similarly, midday meal program also, they are trying to hand over the work of cooking to corporate NGOs like Vedanta, they have set up one, then this Nandi Foundation, then ISKCON, Akshay Patra, they collect foreign funds, they take money from the government and they collect donations, and then they have very big kitchens where around 2 lakhs meals can be cooked at the same time. So, from there they say that they will supply meals to the schools. So, the midday meal workers are being removed from service. So, they do not have any job security, and in addition to that, they do not have security as women at the workplace also. We have many instances of Anganwadi workers and helpers being attacked while doing their job. A few years back in Madhya Pradesh, a supervisor, ICDS supervisor, who was trying to prevent child marriage, her hands were chopped off. And with a case of in Rajasthan, Bhavani Devi, she is not an Anganwadi worker, but working in this type of work. And similarly, in many other places also, one Anganwadi worker was killed in Orissa by some people suspecting that she was a police informer. They were these ivory mafia. So, they killed the Anganwadi worker there. And in many places, because the infrastructure is not good, the Anganwadi centers do not have pakka buildings. Cases have been reported where the roof has collapsed, children are injured, children died, and the Anganwadi workers and helper services are removed. And in some places, the political, when they are handed over to the panchayats, the panchayats representatives, whether it is the president or their relatives, they are forcing the Anganwadi workers. Sexual harassment is there, forcing to work in their homes also. So, very different types of problems they face at the workplace, which the government does not address at all.
What do you think should be the way out of this?
Recommendation by the ILC is a small step. The trade unions have been organizing since many years, and because of the struggles by the trade unions, some benefits they have achieved, whether it is the 1000 rupees for the midday meal workers, small benefits for the ASHAs, and the remuneration which was only 225 per workers and 110 rupees for the helpers in 1992. And even a few years back it was only 500, now it is 3000. Even this meager increase in the remuneration, all these things have been achieved through the struggles of these workers. And because of that, that was reflected in the ILC recommendation. So, what we think is that taking this, utilizing this recommendation of the ILC, the trade unions have to step up their pressure, because there are many recommendations of the ILC which the government has not implemented. In 15th labour conference, that is way back in 1957, the ILC has recommended need based minimum wages, and they have fixed some criterion. Till now it is not recommended. And 44th session last year, that also has recommended that 15th ILC criterion should be taken to fix the minimum wages. It was a unanimous recommendation of the ILC, but this year the Prime Minister comes and he says that the government is considering fixing a floor level minimum wage. The minimum wage itself is minimum.
Floor level.
Minimum. And now it goes beyond and floor level minimum wage, and what we do not know whether pathala level minimum wage also they will fix, but that is the attitude of the government. So, to address this, the way forward is only for the trade unions to unite and fight for the workers, and today they have achieved unity. All the 11 trade unions are fighting together on 10 basic points. So, we decide, I think the way forward is to continue this struggle.
Thank you for sharing your views with us.